Hi, I'm Ana Paula Malinauskas from Brazil, and I will show you our study Physiotherapy for the Stress, Urinary Incontinence, and Postmenopausal Women, a systematic review. It was self-funded and conducted at Inspirar University and Bahiana School of Medicine in Public Health. Our hypothesis was that there is a consistent consensus on the specificity of physiotherapeutics applied to stress urinary incontinence in postmenopausal women. The structure and content organization was based on the recommendation of the PRISM statement and PICO method. The electronic search was performed until April 30, 2021 in the following databases: Medline, Crocan, and Lilacs, and as descriptor we use stress urinary incontinence or urinary incontinence stress, menopause, physical therapy, or pelvic floor rehabilitation. The eligibility criteria were randomized clinical trial, physical therapy intervention as primary outcome. The abstracts were analyzed by two evaluators, and in case of disagreement, an opinion of third evaluator was requested. Participants should be postmenopausal women with stress urinary incontinence, with no neurological disease or disorder. And the study should have physical therapeutic intervention compared with another physiotherapeutic intervention or drug treatment or no intervention. The methodological quality was evaluated by the Pedro scale score, and clinical trials were revised by two co-authors, and in case of disagreement, an opinion of third co-author was requested. Search returned 130 papers, from which 30 papers were excluded once they were found in more than one database. So we had 100 potentially relevant papers. After the evaluation of full tests, 94 papers were excluded. 8 papers were not RCT. 4 papers didn't have a physical therapy intervention, and 10 papers didn't comply with the inclusion criteria. So 6 papers are included in this review. 2 of the 6 papers included were from Pereira et al. In 2012 and 2013. The intervention, frequency, protocol, and outcome measures were the same in both studies. The intervention was vaginal cones, PFMT, and no intervention, and the only difference was in follow-up. In this study was 6 weeks follow-up, in this another one was 3 and 12 weeks follow-up. The only outcome measures with no significance was general health in both studies from King Health Questionnaire. The Pedro scale were 7 and 6. This study is from Capobianco et al. In 2012. The intervention was EMS, FMT, and drug treatment. The frequency protocol are described. The outcome measures were Incontinence Impact Questionnaire and urodynamic variables. The p-value information was not available, and the Pedro scale score was 6. More 2 studies, one from Akzaki et al. 2003 and Bertotto et al. 2017. The interventions were very similar: biofeedback, PFMT, and no intervention. The frequency and protocol are described. The only outcome measures without significance were duration of endurance contraction and ICIQ-ISF. The Pedro scale were 5 and 7 respectively. The last study was from Wang et al. In 2018. The intervention was electroacupuncture versus simulated electroacupuncture. The frequency and protocol are described, and all outcome measures were significant. The Pedro scale score was 8. The variables were urinary loss assessed by the 1-hour PET test, PFM strength assessed by digital palpation, muscle function assessed by perineometry and electromyography exam, and general quality of life were evaluated by different instruments. All studies which use PET test for evaluating urinary loss obtain improvement or cure in this variable, even though there are methodological differences found in this review. Our conclusion: there isn't a literature consensus to physiotherapeutics applied to stress urinary incontinence in postmenopausal women, since all studied interventions, pelvic floor muscle training, vaginal cone, electromuscle stimulation, electroacupuncture, and biofeedback are effective. It seems appropriate to state that further randomized clinical trials should be done, since the limited number of studies and the heterogeneity of interventions did not allow the identification of the most effective one. Thank you.